Hello and welcome to Life is Movement for another exercise demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of these exercises valuable, you're free to use them as you see fit. Just please make sure you do so safely. So this is an exercise that's a slight progression from the wall isometric shoulder abduction that I've demonstrated in previous videos. I'll link to that video here. But these exercises I use in the earlier stages of shoulder rehabilitation, particularly in issues related to the rotator cuff, where often what we see is people get some sort of limitation in their ability to abduct their shoulder. Abduction is bringing your shoulder up to the side like this. And often people in the early stages, they can only get this far and then they get stuck or they're pain limited. You know, it's too painful to lift the arm any higher. Once you've done the earlier version, the wall isometric abduction exercise, what often happens is the painful point moves up the range of motion. So as you can see up here, I can no longer use a wall for resistance because it would be impossible. So the next progression from this to move up the range of motion with the same type of exercise, that isometric style hold, is of course to use some very light weights. Now, my favorite weights in my gym are, of course, the tiny little weights. These are 1/2 kilo each, and they're very handy. So once the painful range of motion is no longer here and becomes here or higher than that, all we're going to do is the exact same thing, but using the resistance of the weights. So we're going to kiss the edge of discomfort where, oh, maybe that's the painful range right there, right at a 90-degree angle. So arms straight out to the side. And we're going to do the same protocol. 5 sets or 5 repetitions of 5 seconds. So we're going to 5, 4, 3, 2, 1, and then lower under control. Don't just drop the arms. Rest a couple of seconds, maybe shake it out. When you're ready, go again. 5, 4, 3, 2, 1. That's set 2. Lower under control. Let's pretend we've done set 3 and set 4. And then the final set, 5, 4, 3, 2, 1, and lower under control. Try that exercise, that isometric shoulder abduction, but this time with the weights, as a progression from the wall version. And eventually, the painful range will get higher and higher and higher. Same principles as before, never push into pain. You only want to kiss the edge of discomfort. 2, 3, maybe 4 out of 10 discomfort for all of these exercises, only into a tolerable discomfort level. Give it a go.